with the heads of our regional economic communities. And in the course of doing so, I got a sense that we in SADC also needed to, as a community, have a discussion on the topic of the day, which is coronavirus. And I was able to make contact with our chair, President Magufuli, and had a discussion with him. And out of that discussion, the issue that he raised was just a logistical one, that it might be difficult to have a discussion, and he suggested that suggestions could be written down and all that. And I still felt that it was necessary, however, particularly for the immediate neighbors that we have as South Africa, as we are carrying the biggest burden on the continent, and that we've got contiguous neighbors that we need to share some thoughts and experiences with. This meeting was then conceptualized, which I shared with a number of my brothers. I could not reach everyone at the same time. We also felt that it would be good, other than just focusing on those who immediately border the Republic of South Africa, that we should also have this experience sharing with Angola, so that we can broaden the reach. I will, following this, also be having a discussion with my brothers in Malawi as well as Zambia, because there are a number of commonalities there as well. So I just thought I should give that as a background to the way the meeting has been structured. I have also in the course drawn in the chair of our organ, President Mnangagwa, particularly as we have interacted at the AU level. There have been some meetings where I've kindly asked our chair of our organ to participate. Last week we also held a meeting with the REX, and unfortunately, to my regret, SADC was not represented at that meeting. And so I did feel that without even holding any official position in SADC, that at the very least we should be able to share experiences amongst us as immediate neighbors, sharing borders, including Angola as well. So that then gives the background to the conceptualization of this meeting. And allow me, therefore, as the initiator of this meeting, to express my deep gratitude to all of you, heads of state and government, and our ministers, for making yourselves available to participate in this vital discussion which we are having on a virtual basis through technology. As we all know, we are all confronted with an unprecedented public health crisis that has far-reaching social and economic consequences. I think our numbers, while on the African continent compared with other continents, are not as high. However, we are seeing an increase. And of course, we are all concerned about the impact of this virus on our communities and our societies, but more importantly, on our economies as well. We therefore thought it was important, as I have already indicated, to have this discussion, largely because whatever we do will will have one impact or another on our immediate neighbors, because this virus does not respect any borders nor make any differentiation as to nationality. So we therefore need to be responding as we should. Now, considering the social and economic linkages between our countries, when one of us is vulnerable, we all become vulnerable. In our capacity as chair of the African Union, South Africa has been quite involved in various measures undertaken by our union to contain the spread. And I also thought it would be important to share the information in our own region. We have hosted 2 virtual meetings of the Bureau of the Assembly of the AU Heads of State and Government. And amongst other things, the Bureau agreed on the establishment of the AU COVID-19 Response Fund. I must say that it was one of those meetings where we were able to invite other heads of state. We in our region asked the chair of our organ, President Mnangagwa, to participate, and other regions also asked others to participate, not necessarily the heads of their RECs, but we had fairly good participation. So we set up this fund, and we were also able to raise additional funds for the Africa Centers for Disease Control and Prevention. And we've now embarked on a fundraising campaign across the world for this fund to be given the resources. To date, we have managed to raise $25 million for the response fund, and an additional $36 million for the Africa Disease Control Center. In our region, Zimbabwe and South Africa were able to contribute funding, as well as some business people as well. We have also appointed 5 African Union COVID-19 special envoys to follow up on the pledges, as well as to mobilize further international support and campaign for international participation. And these envoys that we've appointed are Dr. Ngozi Okonjo-Iweala of Nigeria, and Dr. Kaberuka of Rwanda, Mr. Tiam of Cote d'Ivoire, Trevor Manuel of South Africa, and Mr. Abderrahmane of Algeria. So they are the special envoys that we appointed, who are now scouring the world and campaigning for funding. We've addressed the virtual summit of the G20 and a virtual joint meeting of the World Bank and the IMF, where we called for, among others, the allocation of more special drawing rights allocations to Africa and to provide much needed liquidity to central banks. But we also took time in those engagements to call for the lifting of sanctions against Zimbabwe and Sudan. We also urged for a waiver of all interest payments, as well as the multilateral, as well as bilateral debt, and this would provide the necessary fiscal space for African governments. In general, the response from the international community has been positive, with various partners making pledges, offering debt relief measures, and providing concrete support in the form of medical supplies. with regards to medical supplies, which I'll come to. Now, while the World Bank and the IMF have supported a debt standstill for 9 months, we believe that given the extent of the anticipated damage, we will need a debt standstill for 2 years. And in fact, in other meetings, we've also been saying that there should be consideration also of debt cancellations. One of the biggest challenges the continent faces is access to personal protection equipment. As the AU Bureau, we met with several of Africa's business leaders to seek their assistance in ramping up local production of these items and sourcing them from other parts of the world. I felt that there was a need for us to drive this very, very strongly, and therefore appointed Zimbabwean businessperson Strive Masiyiwa to assist with efforts to source personal protection equipment for the region and the continent. And he had already started this work, working with a number of leaders on our continent, and we felt that we should harness his energy and his capability to do this for us. And I've also engaged with leaders of various countries such as Cuba, as well as China, Russia, France, Canada, and the United States to ask for support for the continent. As for ourselves as the South African government, we've moved quickly to respond to the virus. Our strategy has been the delay of the rate of transmission, but my colleagues will be able to deal with this in a little while. So, colleagues, I thought that we should just give this broad background of the work that we've been engaged in at the continental level and internationally to respond to the virus. And in my conversations with a number of you, I felt the need to also report at home in our own region, so that my brothers should have an idea of the type of work that one has been involved in, the various engagements, and also to draw some wisdom, which I have been fortunate enough to draw from. So it is this that we thought we should give as a background and a context to the reason why we felt it would be important to have this meeting. And I'd like to thank you for agreeing to be part of this dialogue and engagement. I have not dealt with what we are doing in South Africa, as my two colleagues will, as we move after we've heard from the heads of state and government, will be able just to give us a briefing on what we are doing and what stage we are at in dealing with the virus.